Morning, friends. So today we will start the anatomy of sensory systems. So you all know, sensory system involves eyes, nose, ears, skin. These are the and the touch. So today, sensory system means it is the communication from the outer world to the inner world of our body. Uh, so here we will go serially one by one, beginning from our eyes and the vision. So in this chart, all of you can have a look. The sensory systems of anatomy uh, involve vision, hearing, balance, taste, smell, touch, pain, proprioception, and interoception. So regarding the vision, hearing, balance, all these things, these are the common terminologies you must be knowing. So coming to the proprioception, what is proprioception exactly is it is about the sensation of a movement of our body and the position of the body. It is all about getting know where the in which angle our body is moving and whether it is a flexion, extension, all sorts of the about the angles of the body. And next is interoception. Interoception means it is about the sensation of the internal organs of the body regarding the pain of the body, for example, difficulty in swallowing or pain in stomach or pain anywhere across the body. It is the perception of a temperature. These all about and about the sensation of relaxations of our body or contraction of our body. These are all the internal sensations of our body, as the terminology itself it is indicating. Interoception means it is the sensation regarding the inner side of our body, regarding all the organs of our body. So next, coming to the eye and vision. So here the two eyes, eyeballs, are situated in the orbital cavity of our skull. The diameter of the each eyeball is about 2.5 centimeter approximately. And coming to the structure of the eyeball has mainly three coatings. The outermost coating is called as the sclera. Sclera is nothing but the whiter portion of our body, which when we look at the eyeball, we can see the whiter portion of the large portion of our eyeball is the whiter portion, that is called as the sclera. Sclera is the outermost coating, which consists of toughest fibrous coat to maintain the shape and structure of our eyeball. And the purpose of sclera is to hold from the collapse, from the external pressures and from all the internal pressures. It will protect our eyeball. That is the reason it has made up of toughest fibrous coat. And the except the front part of the eye, the remaining two-third of the eyeball, here you can see the two-third of the eyeball, it is completely made up of sclera at the posterior part, that is posterior means the back part of our eye, and the except at the small part of the anterior side, here it is known as the cornea. Cornea is when we close our eyes, so here we can palpate little bulging in our eye. So this little bulging portion, it is called as the cornea of our eye. So this part is the cornea. The cornea, at the center of the cornea, there is a small hole that is called as the pupil. So this hole is meant for the entrance of the light. So the whenever the light enters or the images of the objects enters our body, like these all the images will be entered through this small hole that is called as the pupil. So this pupil is, the size of the pupil is adjusted by the two small muscles here. They are called as the ciliary muscles. These are the ciliary muscles. The contraction of the ciliary muscle, like whenever we get the bright light, then the ciliary muscles will get contract. The ciliary muscles relax, and so that the size of the pupil that becomes very small, so that our body can adjust to the bright light. Similarly, when we get the dim light or towards the evening, when our eyes start struggling to find the objects, so that time the ciliary muscles, these muscles, they contract. So when the muscles contract, the size of the pupil that becomes larger, so as to send the proper images to the retina. So next, the main function of these ciliary muscles is to help in adjusting the size of the pupil by relaxing and contracting. So next, coming to the crystalline lens. So just behind the pupil, there is a crystalline lens. So that the lens again, with the help of ciliary muscles, depending on the images and the brightness of the light, it accommodates, like sometimes whenever there is a bright light, the lens will be little bulged, and whenever the light is dim, the lens gets relaxed. And again, this is under the control of the ciliary muscles. So next is like the mainly our eyeball has divided into two portions. One is the anterior chamber. This is the anterior chamber here, and this is the posterior chamber. The and both of the chambers, they are filled with the aqueous fluid. This mainly the anterior chamber means the anterior means the front portion, and the posterior means the back portion of the eye. So the front portion of the eye, mainly it has aqueous solution. Aqua means it is water. You all maybe knowing. So this is the aqueous solution is little bit just like a water, so as to maintain the pressure of our eyes and to send the images smoothly by adjusting the its nature of the light. So here next, in the posterior chamber, there is a jelly-like fluid containing the nutritious products which are which required to our eyes. This is called as a vitreous humor. So this is the anterior portion of the eye containing the aqueous humor, and here the posterior portion of the eye, that is the back part of the eye, that contains the vitreous humor, that is thick jelly-like substance containing the nutrition to our eye along with the blood vessels. So the outermost of our eyeball is surrounded by, front part is the cornea. At the center of the cornea, again we'll repeat it. The front part of the eyeball is with the little bulging portion of the eye, that is called as a cornea. At the center of the cornea, there is a small hole that is called as a pupil for the entrance of the light and images. And just behind that containing a aqueous fluid inside, just behind this aqueous fluid, there is a crystalline lens, and these both the iris and the lens, they are accommodated by the, they are adjusted by the ciliary muscles. And the posterior part of the eyeball, the posterior, the two-third of our eyeball, almost little bit to the anterior part as well as the entire posterior part, that is made up of the white portion of our eye, that is called as a sclera, containing the toughest, made up of toughest fibrous coat. The next layer, the middle coat of the eyeball, is called as a choroid plexus. It contains containing the blood vessels and supply to the eyeball. The supply to the eyeball is mainly from the internal carotid artery. The carotid arteries are the largest arteries, are the blood vessels which supply to our brain and neck. So the portion of the eyeball is supplied by the entire portion of the eyeball is supplied by the internal carotid artery branches. And the innermost sensitive coat is called as a retina. The retina is this is the innermost coat, that is the retina. Retina is also called as a nervous coat of our eyeball, which is mainly which plays a main role in forming of our images. Retina has the smallest cells again, they are called as the rods and cones. These rods help in forming the adjusting the dim light and forming the images from the dim light, whereas the cones are the one which help in uh, cones help in conducting the bright light and forming the image, colorful images, as well as the for the bright images. So this the at the posterior part of the eyeball, there is a optic nerve. So here the rods and cones. Again, coming back to the retina, retina is the most sensitive inner layer of eyeball, which is also called as the nervous cell eyeball, a nervous layer containing the rods and cones. So here in the retina, when the light enters through the pupil, get passes from the aqueous humor, from the lens back to the rods and the cones, and here from the rods and cones, these signals are converted to electrical signals. And these electrical signals, these you can see the just like the wiring structures here, they are nothing but the optic nerve and the branches of the optic nerve. And these the once the images are formed by the rods and cones of the retina, these images get converted to electrical signals, and these electrical signals, just like these wire structures from the branches of the optic nerve, will be carried to the brain.
We'll see video.
So we'll have a look at one of the small video and we'll come back.
Let's explore the functions and the parts of the human eye. So if you were to look at the human eyeball, it's pretty spherical. And if you were to take a cross section of it, this is what it would look like. There are a lot of parts, but let's look at one by one. The first part we're going to look at is the iris. The iris is what I've drawn in green over here. Most people have brown eyes. When we talk about the eye color, we're talking about the color of the iris actually. Some people have blue eyes and all of that. But what does iris really do? And what does it really look like? Well, it's kind of like a disc. This is a three-dimensional view and the parts of the human eye. So if you were to look at the human eyeball, it's pretty spherical. And if you were to take a cross section of it,
this is what it would look like. There are a lot of parts, but let's look at it one by one. The first part we're going to look at is the iris. The iris is what I've drawn in green over here. Most people have brown eyes. When we talk about the eye color, we're talking about the color of the iris actually. Some people have blue eyes and all of that. But what does iris really do? And what does it really look like? Well, it's kind of like a disc. This is a three-dimensional view. And you can see at the center of the iris, we have this dark thing, the dark thing that you have probably seen, right? That's actually the hole in the iris, all right? And that's what we call the pupil. What's the job of the pupil? Why do you have a hole? Well, because we want the light to enter. So the light enters into the eye through that hole. But what's interesting is that the size of this pupil can change depending upon how much light we have. For example, if there is a very little light in this room, if it's very dark, then the pupil will actually become larger to allow for more light to come in. And if there's a lot of light, the pupil can actually become smaller. So you can see the pupil actually controls the amount of light that enters the eye. And let me show you that. So if you shine light into the eye, look, the pupil became smaller, just like what we saw over here. Okay, so going back, that's the iris, and this hole in between is the pupil. What else do we have? Well, we have this.
So here, like, one of the most interesting thing is like, certain peoples will be having a blue eyes, certain will be brown and a black eyes and a green eyes like that. So what is the reason for that is like, here the inner layer of this cornea has the melanocytes. There are the specific cells called as the melanocytes. These melanocytes will be secreting the melanin. Depending on the quantity of the melanin, the color of our eyes is decided as the blue or black, brown, and green.
Bulged part, which you can't really see because it's transparent, that's called the cornea. And its main job is to protect the sensitive parts of the eye. So that if the damage happens to your eye, the first thing that gets scraped is your cornea, but it protects these things that are inside. And that brings us to the question, what are these things inside? What is this thing? Well, that's the main lens of the eye. Why do we want a lens? Because we want the light to be focused, right, on the backside of our eye, and therefore we have a lens. And this lens is not the only thing that helps in focusing. You see, you have a liquid in between the lens and the cornea, which is like a watery liquid, which we call aqueous humor. It's called aqueous because it's a water-like substance. And if you now consider the cornea along with the aqueous humor, that also helps in focusing light. So both the cornea along with the aqueous humor and the eye lens, they together act like the converging lens system of our eyes, and their main job is to focus whatever light is coming onto the back part of the eye. But then what happens once you focus the light on the back part of the eye? Well, we want to send that information to the brain, but to do that, we need to convert light into electric signals. And that's why the whole back part is covered with cells that convert light into electricity. And this group of cells is what we call the retina. And that's what retina do. Retina is basically a bunch of cells that convert light into electricity. So the retina is where the light is supposed to get focused. And then what happens once we have light getting converted into electricity? We need to send that electric signals to the brain. So we need some kind of a wiring system. And that wiring system is what we call the optic nerves. Optic nerves basically sends the electrical signals to the brain, and then the brain processes that information. And now we might be wondering, well, what is there in this region? Is it like empty? It can't be empty, because if it's empty, the eye will not be able to maintain its shape. It will be crushed very easily under the weight. So to maintain the shape, this is also filled with jelly-like substance, which we called the vitreous humor. Vitreous stands for glassy. It's transparent. It needs to be transparent. That's why it's called vitreous humor, and its main job is to maintain the shape of the eye. Okay. The final part that we'd be interested in are these tiny muscles over here, which we call the ciliary muscles. Why are they there? Their main job is to help in something called the accommodation. What does that mean? Let's go to the next slide to quickly understand what accommodation is. So imagine you have light incoming. Imagine you have parallel light coming into your eyes. As we discussed, both the cornea and the lens together will focus the ray of light. In this diagram, I haven't drawn the converging from the cornea and the aqueous humor. but I have simplified it, but both of them are responsible, okay? Remember that, okay? Now to do that, we need to bend the rays of light, isn't it? Okay, but now imagine the object was closer. If the object is closer, then look, we need more bending power. We need to have more power in this converging system. How do we get that? How do we adjust the power? How do we accommodate the power of our converging lens system? That's where the ciliary muscles come into the picture. So the ciliary muscles, when you need more power, they push on that, they contract and they push on this particular lens and they bulge it and increase its power. And similarly, when you need low power, they will relax. The ciliary muscles will relax, and then they will this particular lens will become thinner, and the power will decrease. This is basically what we call accommodation, and this is the reason why we have the ciliary muscles. We'll look at accommodation in more detail in the next video, but these are the main parts of the human eye.
Next, coming to the general remedies of our eyes, like as a broad aspect, this eye tonic for Agarwal's 7.1, it can be given to all sorts of conditions or as a general nutrition to our eyes. Irrespective, it is myopia, metropia, hypermetropia, glaucoma, or any other optic issues. So, in a broad aspect, just to maintain the good health of our eyes, we can go for 7.1 regularly. So this 7.1 Agarwal combination, this has the NM79 liver, all this, the ingredients you can see over here. This mixture here, the mixture number 17 is the I200, which you can get page number 24. So it works on page number 24 of SOAM series of volume 3. So this I200, NM17 in a 200 potency, I200, it works on glaucoma, muscular weakness, opacities, thrombosis, and any kinds of degeneration of the eye muscles. This I200 has argentum nitricum, chelidonium, and euphrasia mainly. And the next, the smaller remedies are the anosmodium, phosphorus, and the rates related to muscular. So along with this eye compound, they have added the liver compounds and then NM48 vitamin I compound and NM96 scar tissue and then vision, OM5 circulation, OM11 eye and OM25 eye retina, OM26 eye muscles, then OM29 macula lutea and OM30 connective tissue. Then again the liver, because here the liver is must for irrespective of any condition of our vision, or it may be the any diseases of the rest of our body. Here the liver is a fundamental organ which will be controlling all the organs of our body. So similarly, we have in the Vibronics the OM11I. The OM11I, the page number is 132. This helps in maintaining the lens of our eye, then oculomotor nerve, optic nerve, and the retinal parts of our eye. So this number containing the rates for the lens, oculomotor nerve, optic nerve, and the retina. This is totally overall this OM11 eye, OM25 eye retina, OM26 eye muscles, then macula lutea, and OM30. One by one, we'll go serially. Here OM25 has the page number 141. This OM25 helps in the maintenance of the cones of our eye, cranial nerves, rods, and the retina. And the uses of this OM25 is it will help in balancing all the retinal irregularities, and it can be used frequently, thrice a day regularly. And the next is OM26. OM26, the page number again 141 of this Soham series of Natural Healing Volume 3. This OM26 containing the rates for the cranial nerves 2, 3, 4, 5 and the muscles. This cranial nerve 2 helps for the sight, cranial nerve 3 for the external muscles, cranial nerve 4 for the external oblique muscle, and the cranial nerve 5 for the trigeminal nerve. So similarly, the rest all these you can get the there's a balance remedies 20i, then in the Soam series SM14, the chemical poison, where the persons they are working in some industries like where the pollution rate is high, just to protect their eyes, they can go for a SM14. And similarly, the patients who are suffering from the glaucoma issues, or the glaucoma means that is the imbalance in the imbalance in the eye pressure. So here that is because of the imbalance in the circulation. So such glaucoma patients can be used this SM15, and similarly the eyes 20 for the general maintenance of the eyes. To give the super protection, you can add the brow chakra and the crown chakra and the cat's eye, then among the gems ruby, and the bladder meridian, and the circulation sex meridian, and the kidney meridian, and the liver meridian, and the triple wormer meridian. These all the meridians can also be added for the uh, as an additional boosters. And coming to the single drugs like again in the gems like a cat eyes, ruby can be used for the more benefit of our eyeballs. And next is bladder meridian, circulation 6 meridian, and the kidney meridian, and the liver meridian, triple worm meridian. Then single drugs are calcarea phos, mag phos, natrum mure, natrum sulf, and the adrenal. These all are the single drugs of our homeopathy, which greatly helps in the health of the eye. Then arnica, as all of you know, from the any injuries to the eye, where there are the vision is getting disturbed. For such reason, like arnica is used to correct the injuries. And next is ignitia. Ignitia is a drug where there is a history of shock and a continuous weeping, and for example any because of any loss of the family members or any accidents or anything, like anything where the person gets a severe mental shock, and thereon the vision gets impaired. In such occasions, one can add ignitia for 1 week or 15 days regularly, twice a day. Then lysis, where the circulation is improper, just and because of the improper circulation, when getting glaucoma or other conditions of the eye, the lysis can be used. Next is the Naxomica. Again, this is a topmost drug of homeopathy, where the Naxomica, because of the unwanted or the unwanted heavy foods, the rich foods, or the problems resulting from the side effects of any allopathic drugs, especially the steroids, the long-term use of steroids for any other systemic illness of our body, that indirectly resulting the impacting our vision. So there, to nullify those side effects of the steroids, we can go for Naxomica. Likewise, the thyroidinum, where the because of the thyroid imbalances, either hyperthyroidism or hypothyroidism, where the chronic conditions of these thyroid imbalances, one starts getting the imbalance in vision also. So in such occasions, we can go for thyroidinum. Next is the argentum nitricum. This argentum nitricum specially indicated to the persons where there is a constant mental pressure, hurry and worries. These resulting into imbalances of the eye can be go for argentum nitricum. Then coming the cortisone. This cortisone is just like this is a natural steroid. Wherever the person is into shock or is unable to combat from the chronic eye diseases, especially the glaucoma, there the cortisone can be regularly, this natural cortisone can be regularly used. Next is the ginkgo mat. Ginkgo mat is one of the greatest tonic of all the nerves anywhere our body, not only the eye. It is especially after the exhaustion of our eyeballs, where especially for the IT holders, where they have to be in front of the system on the 12 to 24 hours. Such people can go for ginkgo mat on and off. Then the ruta again, whenever the eyes gets injury, so because of the injury leading to any other any disturbances of the eye, one can go for ruta as well as arnica, along with the hypericum also. Next is the aqueous humor. The rate of the aqueous humor from the book can be used where there is the eye problems because of the imbalances in the aqueous humor of the anterior, the frontal chamber, as just we discussed. And next is the strengthening of the optic nerve, and likewise the oculomotor nerve, the rates for we have separate rates for optic nerve as well as a oculomotor nerve. This is called as a cranial nerve. Next is it for the trochlear nerves. These all are the cranial nerves which indirectly help in balancing our vision. Next, this is the abducens. This is the rate where the for the proper accommodation of our ciliary muscles, this abducens rate can be used where the muscular strength is lost. In such occasions, this rate can be used. Next is the conjunctiva. This conjunctiva rate can be used in general as well as specifically in the Madras eyes, where there is a conjunctivitis, the inflammation or in common terms swelling of the conjunctiva, producing the redness of the eyeball, spreading. It is contagious. The conjunctivitis, like so, the here the conjunctivitis. All of you must have come across. These the called as often we call this as Madras eyes or red eyes, where this is mainly due to the viral infections where the conjunctiva gets swollen. So in this, the greatest remedies are like from the Narayana series, we can go for penmycin, war, and the infection also. Also the rate for pterygium and inflammation and infection. Also, we can add one of the most important drug of single drug, that is the euphrasia, where there is excessive watering and like sand, as if the sensations, as if the sand in the eyes with severe itching and burning and discomforts in the eyes. These all can be combated by the euphrasia along with these additional rates. Next, coming to the close.
ಇದಂದ್ರೇನು?
ಇದು ಕ್ಲೋಸ್ ಮಾಡಿ ಸ್ವಲ್ಪ. So next, coming to the fundoscopy. So what is fundoscopy? Just like we all know, if we have the esophageal food pipe problem, there we go for the endoscopy. That is the endoscopy is the one like a pipe at the end, microscope, so where it is inserted in the throat and to visualize the inside abnormality. Likewise, we have a laryngoscopy for the our larynx. So likewise, the colonoscopy for the large intestine. Likewise, here for the eyes, we have fundoscopy. It is an instrument containing the microscope to detect the detailed pictures of the eyeball to find out the abnormalities. So these are the some of the common features of the or we can say the diseases of the eyes. One among the most common is the macular degeneration, and next is in the macular degeneration. The here in this picture you can see the central part, it appears blurred, whereas the surrounding part will be little clear. This is a called as a macular degeneration.
In fundoscopy,
So in fundoscopy, this is a normal retina, and when we detect the eye with the help of fundoscopy, there you can see here the retina is bulged. So next, coming to the most important topic, to say the major illness of our eye is glaucoma. So the glaucoma is the most important disease, as like it is a irreversible. The rest of the are just like allergic eyes or madras eyes, or it may be myopia. These can be reversed, but the glaucoma is the one with this very serious condition. One must be alert. Once it here the nerves getting degenerated, it can't be reversed. So the glaucoma part we must understand thoroughly. So what is glaucoma exactly is the because of the imbalance in the vitreous humor and the aqueous humor, there is a uh, great imbalance in the internal ocular pressures, so causing the high BP inside the eyeball. That is the normal BP inside our eyeball is 10 to 20 mercury. So once this exceeds the more than 20, the condition called as the glaucoma, where the person start getting the initially with a slight headache, some maybe with a nausea, vomiting sensation, with a blurred vision. Uh, Gradually, there is a loss of vision, where the nerves of our eyes start getting damaged. This is because of the constant high pressure in the intraocular pressure, which the starts getting damage to the retina, there onto the nerves. So this glaucoma, mainly the causes of the glaucoma is one is the diabetes, then in other chronic systemic illness of our body, the continual usage of any the steroids or some of the allopathic drugs, or sometimes it may be congenital also, where it can be seen in from the right from the childhood also. uh, Most commonly, this glaucoma is seen uh, after 55, I can say 60, but not to be neglected. Sometimes it can be hereditary also from the childhood. So it is the mandatory to get the visual test at least once or twice a year from the ophthalmologist, and get the proper diagnosis for the treatment. So here in diabetes or the any other chronic illness, what happens is the retina starts the nutrition of the to the retina is will get improper. Thereon indirectly it causing the variations in the intraocular pressures. That pressure, constant pressure on the retina, again falling on the nerves, causing the gradual damages on the nerves over a period of years. One may completely lose the vision, causing the blindness. So immediately it has to be corrected, and we have wonderful medicines in homeopathy. So in homeopathy, the most indicated medicines for glaucoma is the single drugs are the number one is phosphorus. The phosphorus where it can be especially it is suitable for the taller and tall and thin persons who are highly social, mentally highly intellectual, and who are very susceptible to cold. For such constitution, we generally indicate the phosphorus. Likewise, in homeopathy, in a broad spectrum, these are called as a constitutional treatment. For example, it is like for a taller and intellectual people who are very social, who cannot bear the cold. For such persons, phosphorus is the main drug. And likewise, the coming to the automat, where there is a mental and physical destruction, where they fall into syphilitic categories, where there is a memory loss and great depression, and along with the glaucoma, there will be other many systemic disorders, where in such cases we can go for automat. Likewise, the persons who are very tall, lean, thin, who cannot sustain the heat in any form, for them we can go for the sulfur and lacases. Likewise, in homeopathy, we have medicines like a ocean, depending on their the constitution. So one day we will go for the constitutional drugs. So after these topics, so that it will come into the detailed picture of the very interesting features of the constitutional drugs, how they can be classified and perfectly fit to the individual categories. Like, so next is onosmodium is one of the most important drug, where there is the from the different a person sees the different colors from one angle, one color, another angle, another color, or just like a rainbows. So this can be beautifully covered by the homeopathic medicine, that is called that is known as onosmodium.
How it looks in
So here in glaucoma, the images are the in the central part. There is a little bright, intense light can be seen. The surrounding is a blurriness uh, associated with the little headache, vomiting sensations, or these are the common features. Sometimes there is a mild watering also. So in fundoscopy, this is the normal retina, and this is the affected retina, where you can see there's the bright abnormality here. So as I have briefed just before, like this glaucoma is the mainly because of the intraocular pressure variations, because of the constant imbalances in diet or some drugs, or the exposure to the industries, chemical industries, uh, or it may be hereditary. So here in the glaucoma, this is a healthy eye where the flow of aqueous humor through the drainage canal is proper. This is the glaucoma eye where the drainage canal is blocked. This here you can see the increased pressure damaging the blood vessels and the optic nerves. So in the fundoscopy, there's like in a healthy eye is seen like this, and the glaucoma affected eyes will be like this. So the early symptoms again will repeat. The early symptoms of this angle closure, again in the glaucoma, there is many different varieties, like the angle closure glaucoma, pigmentary glaucoma, like that we have different the differentiations and the deeper classifications, where in the if anybody interested we can go in detail in the next classes. So in the early symptoms of angle closure glaucoma are severe pain in the eye or eyebrow, headache, nausea, blurred vision, and rainbow halo colored rings around the bulb light. Immediate care should be taken if two or more of these symptoms appear together. So the one of the most commonest feature, like which is the almost everybody in the certain age after crossing the 50 getting affected, is the cataract. So what is cataract exactly? Is cataract is the opacity or cloudiness of the lens of the eye. So over a period of years, what happens is the imbalances in the calcium level, vitamin D levels. This again related to the age. So over a period of year, these imbalances and at the same time the losing the elasticity, this all the finally result into where the opacity of the lens is resulting into the opacity of the lens causing the cataract. So here you can see this is a clear lens and this is a cloudy lens where the opacity is seen because of the imbalance in calcium, vitamin D, and the loss of elasticity. Because these are the age-related issues. So here you can clearly see the opacity is getting increased. So for the cataract, to how to combat cataract is from the early ages, one can go for the cineraria.
Yes, yes. Here,
So this cineraria martiva is a wonderful medicine in homeopathy which help in combating the cataract. This cineraria martiva
calcarea floor.
along with the calcarea floor 6x, cineraria martiva in the form of drops to be used regularly twice a day over a period of months or can say 1 or 2 years right from the beginning where the cataract starts developing slowly. So along with this Cineraria martima, this we can go for the beautiful eye compound, that is the mixture number 47, the page number 59 of from the Soham series. That is cataract compound 1M. Yeah, this to be used regularly 3 times a day, around 6 to 8 months, right from the beginning of the cataract itself.
Split up.
This can be used along with the vitamin I compound 10 to get the to maintain the nutritional values of our
We will
eyes
appreciate
also. So here the cataract compound 1M, it has the following ingredients. That is crystalline lens, the rate for the crystalline lens and collagen, which help in balancing this condition. And the next is a naphthalinum. This is one of the homeopathic individual drug, which has a great affinity for the eye, in healing the detachment of retina. This for all sorts of the retinal detachment, irrespective of the causes of the retinal detachment. Also, this naphthalinum can be used. Next is the thiocinaminum. This is again one of the most important drug of homeopathy. Thiocinamin helps in dissolving the scars of our eyes where the one starts getting older, the scar tissue starts appearing because of the loss of the elasticities uh, anywhere our body, not only the eye. So this thiocinaminum is one of the greatest drug to dissolve the scar tissues specifically, thereby helping the vision. Next is the natrimure. Natrimure again, this the can be used for the chronic illness of the any of the conditions of our eye resulting in from the continuous shock or exertion of our eyes. Natrimure can be used as a general tonic of our eye. And next is the calcarea floor. This calcarea floor specially used in all of the eye conditions where the conditions resulting from the loss of the elasticity, particularly. This calcarea floor is one of the drug famously known as the cosmetic agent or the especially for the old age also it is taken into geriatric or medicine also. It will from the wherever our body has the loss of elasticity, this especially the calcareous floor rebrings the elasticity, thereby giving the sense of anger. So it can be used in the cataract also to maintain the elasticity of our eye. And next is the silicea. Silicea, it helps in clearing the opacity, removing the scar tissues and clearing the opacities, thereby improving the lens.
Common problems of
Next, coming to the refraction errors, these are the most common problems, especially coming in this generation. The more and more the rate is getting increased, especially in the childhood itself, like where we come across many kids wearing the glasses right from the childhood, unable to see the boards, and where in the TV they come closer to the TV and they with the shrunken eyes they'll be struggling to catch the letters. So one of the most common refraction error is a myopia. This myopia, and the next is a hypermetropia. This myopia is most commonly everywhere, especially it is most increased in this generation. We can say why this the here the myopia is the also called the close friendly disorder, where the person fails to see the nearby objects, or the nearby objects are very blur. Uh, can say the dim vision of the nearby objects, and one will be struggling to read the nearby subjects. So the here like the homeopathic drugs wonderfully helping for the myopia is
vitamin deficiency.
this may be because of the vitamin myopia is again the causes varies, like maybe because of the vitamin deficiencies, or it may be hereditary, or it may be the continuous work pressure, or maybe because of some constant chemical drugs or steroids. So here in the from Vibronics, vitamin I compound 10M, that is the mixture number 48, page number 60 from the Narayani series. This vitamin compound 10M that greatly helps in boosting this error. The single muscle of the the single drugs in homeopathy which greatly helps the myopia is physostigma. Physostigma in a 3x form regularly twice or thrice a day for around 6 months to 1 year. That greatly helps in correcting the myopias. And apart from the physostigma, next drug is gelsemium and sulfur and the phosphorus and the aurum metallicum. These are the some other medicines which help in correcting the myopia according to the different constitutions. The most important drug here is physostigma. Yes, sir.
Thank you, Dr. Suvarna, for being with us, explaining about the eyes. Now, you added your homeopathic experience along with Vibronics, and all these homeopathic remedies can be made with vibronics rates from the numerical materia medica, and the same potency, same as explained by Dr. Suvarna, can be taken. So we will end up this with a small again one video, so that videos are those things which imprint the thought in our brain, so vocabulary of the eye, so that wherever we find there is a problem, we can trace and go back into the root of the disease. And I'll also share the PDF and also the chapter of eye. If will in case of any doubt, you list it. We'll ask Swarna to clear those whenever we are free, or can say next session will be the most session will get to clear the doubts, and Suvarna will also be taking the case taking as per the homeopathic method. So that is very interesting, so that we will be able to work accurately, scientifically. Okay, so we'll be able to, we will have a very great journey. And as I am already thinking that we should stand at par with a homeopathic doctor. Only our remedies will be from vibronic system, but rest all will have all the capabilities, all the abilities, just like, okay, homeopath. So we will learn everything. We will learn everything, how to diagnose, how to systematically diagnose as per the homeopathic system. So that is our motto, and we will see one more video, and we'll end our eyes the session. So yes, do you like to know anything more about it? Dr. Suvarna is asking any questions regarding the eye. She'll be able to help you in clearing those things. Any question regarding eyes? You can please.
Everything is clearly explained by Madam, sir. Thankful to Madam. No
Thank
doubt,
you.
sir.
Sorry, I'm suffering from little cold and cough.
Yeah.
Maybe causing some discomforts to you all.
No, ma'am.
Rajeshwari madam.
Like that.
ಚೆನ್ನಾಗಿತ್ತು ತುಂಬಾ.
Thank you, madam. Sorry, ನನಗೆ ಸ್ವಲ್ಪ cold cough ಇದೆ. I'm little bit discomfort and sorry for the inconvenience.
ಅದೇ ನನ್ಗೆ ಸ್ವಲ್ಪ ಲೇಟ್ ಆಯ್ತು ಜಾಯಿನ್ ಆಗೋದು. ನಾನು ಇದ್ರಲ್ಲಿ ಬಂದಿರ್ಲಿಲ್ವಲ್ಲ, ನೋಡ್ತಾ ಇದ್ದೆ. ಇದ್ರಲ್ಲಿ ಹಾಕಿರ್ಲಿಲ್ಲ, ಆಮೇಲಿಂದ ಹಳೇದನ್ನೇ ತಕೊಂಡು ಹಾಕೊಂಡೆ.
Sorry, also like I'm in certain anxieties. Like there's this is almost this first to second class for me. Like I hope in coming classes I'll be more clear.
ಆಫ್ ಕೋರ್ಸ್ ಮೇಡಮ್, ತುಂಬಾ ಚೆನ್ನಾಗಿದೆ.
Thank you, thank you,
ಥ್ಯಾಂಕ್ ಯು.
thank you.
So we'll see one more video which has got a little deeper level. So with that we will end this morning session. Again we'll meet at 4 o'clock, and we'll study about the other sensory organs.
How are you listening to this music right now? Let's explore the functions and the parts of the human eye. So if you were to look at the human eyeball, it's pretty spherical. And if you were to take a cross section of it,
I think so. We have already seen that. So we have already seen that video, and By here we will end this session, and by sitting we together, I am feeling as if there can be a little questionnaire session also, like in a TV, Rangana, what Rangana does, we can discuss the things so that for you also it will be an interactive thing. Sometime whatever you wanted to ask will be asked by me, so that it will be a very interactive one. I am thinking in that way, so that the more knowledge can be shared.
Yeah, please come up with any questions or anywhere like you want to be clarified in detail, or anywhere there are confusions like.